Peel expands vaccine eligibility.
When I saw that news on Twitter, I was ecstatic. This is exactly what we need.
All residents 18 and over in Peel, regardless of postal code, will be able to book a shot starting tomorrow. Plus, the Special Victims Unit is investigating after the death of a child at a home in Brampton. We'll have the latest. And
this is incredibly irresponsible behavior. It really, truly disappoints me.
Mississauga's mayor says she's extremely disappointed upon learning of a retirement party held inside the city's Canada Post plant, already subject to partial closures due to an outbreak. Good evening, I'm Kelda Yoon. Peel Region's vaccination campaign is on the eve of a significant new milestone. Starting tomorrow morning, every adult in the region will be eligible to book a shot. Nick Boisvert joins us now live outside one of the region's mass immunization clinics. Now, Nick, sounds like they'll be a little busier there soon.
Yeah, that's right, Kelda. Starting tomorrow, 8 a.m., every resident in Peel Region, no matter where they live, is going to be able to go online, book an appointment, and eventually come to a mass clinic like the one here at the International Centre. Peel is becoming the first major region in Ontario to reach that milestone. So tonight, a little bit more hope here in a region that's been hit harder by the pandemic than just about anywhere else in the country.
I'm going to say it again and again and again because it makes me so happy. We will all be eligible for the vaccine as of 8 a.m. tomorrow.
After more than a year of sharing mostly bad news at her weekly briefings, Mississauga Mayor Bonnie Crombie was feeling a little better this afternoon. She wasn't alone.
There hasn't been many things that have made me happy during this pandemic related to COVID. This is that silver lining, and I'm going to latch on to this so we can get out of it.
The expanded eligibility means about 50,000 residents will be eligible for vaccination tomorrow. They join the residents living in hotspots who are already eligible. And you can see here, those communities make up almost the entire region. Still, local advocates say any progress is worth celebrating.
Most of Peel has been in a hot spot, but even that extra 50,000, getting extra 50,000 doses into arms is a huge deal. This is how we get back to normal.
Peel has just 10% of Ontario's population, but it accounts for about 20% of new COVID-19 cases. That's been attributed to the region's huge population of essential workers. To drive down transmission rates, Ontario is diverting half of its vaccine supply to hotspots for the first half of May.
The 2-week period should be sufficient to bring transmission more under control in these hotspot areas.
Mayor Crombie says the extra support is badly needed, but she says 2 weeks isn't enough.
Well, I'm going to convince the government to do the right thing because clearly the rest of the province can't get back to normal until we address the spread of the virus here in Peel.
So not quite all good news just yet, and Peel also announced today the closures of 6 additional workplaces where there have been outbreaks. But heading into the rest of May, the focus is definitely going to be on the vaccination campaign. Right now, Kelda, in the Peel region, about 37% of all adults have had at least 1 dose of a vaccine. By the end of the month, they want to get that number up to 75%. Kelda?
All right, thanks, Nick. That's our Nick Boisvert live for us tonight. The vaccine outlook in Ontario as a whole is also looking a little brighter. The province is now on track to give 2/3 of adults a COVID-19 vaccine by the end of May. Now, what's not clear yet is whether that will be enough to start relaxing public health measures. Our Queen's Park reporter Mike Crawley has the latest details on the provincial rollout.
This pop-up vaccination clinic at Woodbine Racetrack is for people living in Rexdale. In all of Ontario, it's among the neighborhoods hardest hit by COVID-19.
Just come on out. The lineups aren't too long as yet. So come, don't wait until the end of the day.
They're aiming to vaccinate 2,400 people a day, right through until Friday. No appointment necessary.
And I live close by, so I thought I would just drop in here, even though I booked an appointment for next week, but it's better to get it earlier.
There's an abundance of vaccines due to arrive in Ontario every week in May and June, a total of 8.2 million doses by the end of next month.
The light at the tunnel is growing brighter, and we will have more to look forward to.
The province is now on track to give 65% of adults at least 1 dose of vaccine by the end of May. Despite that expected level of vaccine coverage, no promises yet when public health restrictions will be lifted.
We just need to get the transmission down in our communities to a lower level, and we need to reduce the strain on our hospital care capacity system as well. But we are moving in the right direction.
Starting tomorrow at 8 a.m., more people become eligible to book vaccination appointments on the provincial system, no matter where they live. Everyone age 50 and up, everyone with a health condition that puts them at higher risk from COVID-19, and many essential workers, including teachers, childcare staff, and people who work in food processing.
It's really important for everyone to apply for an appointment for a vaccine as soon as you're able to receive one, as soon as it's your turn.
Workplace vaccination clinics are happening this week at big employers in the GTA, including Amazon and the auto parts giant Magna. The province will also supplement what the Toronto, Peel, and York public health units are doing in hotspots. Ontario is sending 5 mobile vaccination teams to small and medium-sized businesses starting Friday. More than 5 million people in Ontario have had a shot so far. Mike Crawley, CBC News, Toronto.
Health Canada has approved the use of Pfizer's COVID-19 vaccine for people as young as the age of 12. Canada is the first country to authorize Pfizer for this age group.
This is the first vaccine authorized in Canada for the prevention of COVID-19 in children and marks a significant milestone in Canada's fight against the pandemic. Health Canada received Pfizer-BioNTech submission for this expanded indication on April 16th. After completing a thorough and independent scientific review of the evidence, the department determined that this vaccine is safe and effective when used in this younger age group.
The vaccine was previously authorized for anyone 16 or older. Pfizer says that the kids who were studied had side effects similar to young adults, mainly pain, fever, chills, and fatigue, particularly after the second dose. Now, it's unclear when adolescents in Ontario might receive the vaccine. The health minister said today the discussions are underway. Canada Post is responding to reports that a retirement party was held at the Gateway Postal Facility in Mississauga last month when the province was seeing well over 4,000 cases of COVID-19 per day. Now, in a statement, Canada Post says we are aware that a brief gathering was held for a retiring colleague in Gateway West in early April. We simply do not allow gatherings within the facility for any reason. This is an unfortunate and isolated incident. Mississauga Mayor Bonnie Crombie was asked about the party at today's press conference.
And I am extremely disappointed in the workers over at Canada Post. They've already been subject to a number of shutdowns, of closures, partial closures. We've had public health investigating the situation. This is incredibly irresponsible behavior. It really, truly disappoints me.
Canada Post says they take this matter seriously and have talked directly to those involved. Well, Colette Kennedy joins us now with a first look at the forecast. And Colette, I did notice a bit of sun peeking through for some brief moments today.
Yeah, it was so nice, right? Oh, yeah, that's there. We're going to have much more of that, though, coming at us because obviously we've been seeing the clearing skies. But the other thing that leads to are some cooler temperatures without that blanket of cloud tonight. So we are looking at frost advisories into southwestern Ontario, but get away from the lakeshore and we could have some frost around the GTA as well with some cooler temperatures there. So look ahead with the clearer skies. It means we start off with some sun tomorrow, but clouds will increase into the afternoon hours. A little more than that coming in to southwestern Ontario into the afternoon hours because you'll see some showers developing. Eventually, though, as we get into the evening, we'll see some of that rain pushing towards the Niagara region. And if this slides just a little bit further north, some scattered showers Thursday evening, even possible around the whole Golden Horseshoe in towards the city as well, okay? A look at your temperatures to go along with this. Tonight, I said cooler. It's above freezing, but still 4 degrees. And certainly tomorrow afternoon, as those clouds increase, we should still be able to get to a temperature of 14, Kelda.
Thanks, Colette. A special victims unit is investigating the death of a child in Brampton. Now, Peel police say they responded to a medical call at a home near Finlayson Crescent and Sunny Meadow Boulevard at around 4:30 today. The scene was taped off and you can see a large police presence there. Now, paramedics transported one person to hospital in life-threatening condition. Police later confirmed that a child had died. Their age or gender was not released and we don't know the circumstances of their death. The SVU looks into any death of a child under the age of 5. It will work to determine if the death is criminal in nature. A construction worker has died after an accident at a Corktown building site this afternoon. Toronto police say the man was hit by a concrete bucket. He was rushed to hospital but did not survive. The Ministry of Labour will be called in to investigate. A man in his 20s is in hospital after a shooting in Etobicoke. Officers were called to East Mall and Rathburn around 2 o'clock this afternoon, and they found a man with a gunshot wound. He was rushed to a trauma center with serious but non-life-threatening injuries. Police are asking anyone with information to contact them. The TDSB is suing the City of Toronto, the Fire Department, and Toronto Police for $90 million relating to a devastating fire at York Memorial School 2 years ago. Now, the fire caused millions in damage and displaced hundreds of students. The lawsuit alleges that the city, police, and firefighters failed to secure a fire that first broke out in the school's auditorium. And because of that, the fire became much larger the following day. The suit also claims that Fire Chief Matthew Pegg made false claims to the media when he said there were 2 separate and distinct fires. Now, in a statement, the city says staff cooperated fully and professionally in the fire investigation, that they took all appropriate steps to preserve evidence, and that allegations suggesting otherwise are patently untrue and irresponsible. The allegations in the lawsuit have not been proven in court.
A little bit of good news in that ICU admissions were plateauing and deaths were plateauing, but they're still very high and we're still bursting at the seams.
Coming up, Ontario hospitals are confident they won't have to make life and death triage decisions, but frontline workers are still being trained to do that just in case. Hear more from doctors on what that's like coming up. In this third wave of the pandemic, some doctors feared they would have to decide who gets potentially life-saving care and who doesn't. It's something doctors in India are grappling with right now as cases of COVID-19 skyrocket. Now, a recent memo to hospitals said it is looking like Ontario will avoid this, but projections are still very concerning. Talia Ricci spoke to a couple of doctors about what it was like getting triage training.
It was really bizarre. It was surreal.
Dr. Shajan Ahmed says he always thought of triage training as something needed in other countries or in war zones.
None of us had trained for it before, and none of us really signed up for this, to be honest with you.
The training included virtual sessions with experts in simulation, ethics, and palliative care. The doctors role-played in mock cases where they would have to apply what they learned to help determine a patient's chance of survival and potentially whether they would be eligible for ICU care.
I think in a real life situation, it'll be exponentially more difficult. And so we all kind of came out of it somewhat exhausted, at least emotionally exhausted, even from this brief training that we had, and just really at a loss for words. It's really not something any of us are accustomed to.
Dr. Erin O'Connor helped lead the training.
This is a hard thing for us to do. And so having people run through some of the decision making and then some of the delivery of the messaging, the goals of care conversations that they would need to have with patients and their families helped people to find the right way to say this kindly and empathetically, and to also kind of recognize and process their own emotions around this.
A memo from Ontario's Critical Care COVID-19 Command Centre to hospitals says it's looking like Ontario may avoid the use of the triage protocol. Cancelling surgeries, redeploying healthcare workers, and transferring patients are just some of the ways the healthcare system has increased capacity.
And the logistics behind this have been massive, but all of these things are being done to prevent us from getting in the situation where we have to triage resources. We're not out of the woods yet because we know patients stay in the ICU for a long time, but at least we're slightly backing away from the potential need to use this.
Dr. Ahmed is cautiously optimistic.
Good news in that ICU admissions were plateauing and deaths were plateauing, but they're still very high and we're still bursting at the seams. And kind of liken it to walking through a minefield. You know, it's you're going to walk, you're going to tiptoe very cautiously, knowing that any minute it can explode, but you know, you're hoping you can get to the other side.
Talia Ricci, CBC News, Toronto.
A group of volunteers in the GTA's Ghanaian community has been working with Toronto Public Health to launch a series of pop-up clinics. Today, one of those clinics opened inside a Ghanaian church. Now, over the past year, community leaders have been holding workshops, town halls, and seminars to answer questions about COVID-19 and to dispel concerns about the vaccine. Our Farah Morali spent the morning at the clinic.
The lineup outside the Etobicoke Church isn't for prayers, but rather for hope in a different form: vaccines.
How are you?
The church is a hub in Toronto's Ghanaian community. Many live close by.
We are very excited about it because it's the beginning of a journey to get our community to be vaccinated.
Since last March, leaders like Emmanuel Duwodu have been hosting community webinars, answering questions about COVID. And there have been lots.
And people get their information from WhatsApp, social media about why they need to take the vaccine and why they do not need to take the vaccine. So with all these competing theories, we have to find a way to make sure that we engage our professionals.
The recent mixed messaging about preferred vaccines hasn't helped either.
Information from NACI, they call it, that is another level of confusion, which we have to find a way to try to clear up in our community. So the good news is that we have medical doctors in the community, nurses, and we try to provide as much information as we can.
Education is only part of the equation. It's also about demonstrating it.
It's very much important because as a pastor, many people are looking up to me as a role model and their leader. And it should be leadership by example. If I take the vaccine, people will take the vaccine.
The local pastor posted his vaccine selfie on Facebook to motivate others. But it's also a team effort. 45 volunteers registering community members.
It's very important, especially for us seniors. Since we are vulnerable and we have so much underlying other issues, it's very important that they get their vaccine.
Like Felicia Botchway, who's been coordinating rides for people to get here.
It's such a good feeling to see a lot of people
in there.
Richmond Antwi already got his vaccine. Today he brought his mother-in-law for hers.
The reason why we need to do this in our community is like, for example, there's a lot of language barriers. A lot of seniors don't know how to speak English or they don't understand it. So doing this in our community, one, is breaks that kind of barrier. And the next thing too, it breaks that kind of tension, because if I know my sister or brother has taken it, it makes it easier for me to take it.
Community leaders say their work isn't done, but lines like these are a testament that their efforts have already paid off. Farah Morali, CBC News, Toronto.
Mainly clear tonight with a few cloudy periods. The clouds will clear overnight, though, making way for some sunshine in the morning. Currently, it's about 8 degrees in downtown Toronto. Let's go back to Colette now with a look at your extended forecast. And Colette, temperatures definitely continue to be a bit on the cooler side for this time of year.
Yeah, they really are. We're seeing at this time of year, you know, our daytime high should be around 17 degrees. And we're really seeing our highs running, and I'm generalizing here a bit, but about 5 degrees below seasonal. And I'll tell you, as I look ahead, this pattern kind of carries on for the next few weeks, it appears. So we'll have some bright spots. Tomorrow, the temperature should bump up a little bit before those clouds get here. But because of the clearer conditions that we're getting through the overnight and seeing less cloud cover, there are areas of frost. That advisory I mentioned earlier in the show for Western Ontario, and we are talking about sun to start tomorrow. So sun in the morning, but then more clouds in the afternoon with the chance of showers coming later in the day, and that risk is enhanced. It's earlier for southwestern Ontario, but it's also enhanced through the Niagara region, and you'd see that into the afternoon and evening hours. The daytime highs today then here even more than 5 degrees right below seasonal, with 11 degrees the high in Toronto, Oshawa at 12, and London just 8 degrees for you there, not able to climb out of those single digits. So here we are tomorrow morning, sunshine into eastern Ontario, around through the north shores of Lake Ontario and Erie. Well, things will change pretty rapidly. So you start with sun, clouds move in, and then into the afternoon hours, some showers, thunderstorm risk in there as well. I do want to point that out, even along the north shore of Lake Erie over towards the Niagara region, where locally then you could have some heavier downpours. Some isolated showers not out of the question for the GTA too tomorrow later in the day, but primarily will be dry before that. And then having a look at Friday, we get some clearing, we'll get some sunshine, but then we get everything, right? So by the afternoon, once again, showers in the forecast, scattered in nature, shouldn't see a lot of it, and that'll start to clear up as the sun sets into Friday night. Here we go tonight with your temperatures. That frost advisory I mentioned for portions of southwestern Ontario, down to 0 for Sarnia and London area. That risk of thunderstorms and temperatures there, just 13 degrees the high for Windsor. Tonight, yes, that risk of frost, the temperature doesn't have to go down to freezing to get the frost, so that risk is there. Markham certainly potential, even around the St. Catherine area and St. Catharines. And look at tomorrow afternoon's temperatures with some of that sun helping to bump us up a little bit. It's going to be good until those clouds get here. Then a little cooler Friday and into the weekend. Chance of showers Saturday. Primarily, though, it should be a drier weekend, Kelda.
Thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
The Blue Jays are creeping closer to home. On June 1st, they'll start hosting games at Buffalo's Salem Field. Now, the Jays have been playing home games at the team's spring training facility in Dunedin, Florida, but the team wants to move before the summer heat and humidity sets in. Last year, the Jays played all their home games in Buffalo. New York State has eased some gathering restrictions. Roughly 4,000 fans who have been fully vaccinated or can present proof of a negative COVID test will be allowed in. Now, that is 24% of capacity. Buffalo is normally home to the Blue Jays AAA affiliate, but the Bisons have temporarily moved to Trenton, New Jersey. It's not clear if the Jays will be back in Toronto this season. And finally tonight, a Dutch artist who's looking forward to her COVID shot has decided she wants to make an event of it by dressing up. But her choice of materials is, well, a little unconventional.
Tadaa! Klaar voor de prikklapper komen.
Yes, that is a dress made out of face masks, recycled from her personal use. And she hasn't just made a dress for Vaccination Day. There are plenty of accessories too, including gloves, a bag with face masks for people who want them, and even a suitably elaborate face mask. Now, the artist says that she's aware people will ask who the crazy woman is when they see her in the outfit, but she wanted to create something beautiful and inspire positivity. I like it. Now that's our show for you tonight. Thank you so much for watching. Dwight Drummond has your next local newscast tomorrow at 6, and I will see you back here tomorrow night at 11. Have a great night, everyone.